All right, let's just jump right in. Today, we're diving into this explainer, which is basically your ultimate blueprint for future-proofing your medical career. I mean, we're living in a time where healthcare is evolving at absolute lightning speed, right? Simply trying to keep up? Yeah, that's just not going to cut it anymore. You really need a strategy to lead the pack. So we're going to explore a comprehensive roadmap designed to take you straight to the very edge of the digital health frontier. What we're looking at here is the comprehensive 5-week digital health and digital pharmacy practice course from the Eximia Global Learning Solution. And look, this isn't just your standard syllabus or a list of classes. It's an experience specifically designed to transform you into a true digital healthcare leader. We're talking 9 core modules and a massive final capstone project. It equips you with the exact practical tools you need to not just navigate, but completely dominate the modern healthcare ecosystem. So the whole journey is grouped into 5 vital themes. We've got 1, the digital health revolution, 2, next-gen pharmacy practice, 3, AI and emerging tech, 4, guardrails, meaning safety and ethics, and finally, number 5, becoming a digital leader. Let's kick things off with section 1, the digital health revolution, where we really focus on understanding this rapidly shifting landscape. Right off the bat, you absolutely have to understand the bedrock of this whole ecosystem, and that is interoperability. Seriously, it's the absolute necessity of seamless communication. Think about it. If an electronic health record at a massive hospital literally cannot speak to the electronic medical record at a local neighborhood clinic, the entire digital ecosystem just fragments. It falls apart. You'll learn exactly how interoperability standards actually solve this problem, right alongside mastering the everyday workflows of electronic prescribing and prescription authentication. Moving right along to section 2, next-gen pharmacy practice. This is all about upgrading your practice's operating system. And wow, there is just a stark, undeniable contrast between the outdated, manual paper pushing of the past and the hyper-efficient digital pharmacy we see today. We're talking about totally upgrading your day-to-day operations, moving away from messy paper trails and stepping into clinical decision support systems that actively, automatically help you prevent medication errors. It is a real game changer. Which brings us to a massive leap forward. I'm talking about telepharmacy and how it completely smashes geographical barriers to care. Through virtual pharmaceutical care and remote patient monitoring, a pharmacist can actually manage a patient's medication adherence without that patient ever having to get up off their living room couch. How amazing is that? Now, what's great is that this course doesn't just leave you hanging in theory land. It breaks down real-world digital health platforms and local case studies to show you exactly how all these best practices are actually implemented out in the wild. You'll analyze local successes, like MyDawa in Kenya, right alongside massive global giants like Amazon Pharmacy and GoodRx. Diving into these platforms helps you really grasp user experience, digital payments, and the very real nitty-gritty integration challenges these companies face every single day. Of course, getting the medicine prescribed, well, that's really only half the battle. You also get equipped with the essential logistics tools of the trade. This ensures medicine traceability and safety all the way from the warehouse directly to the patient's front door. Module 7 goes deep into track and trace technologies, product serialization, and that absolutely crucial cold chain monitoring. Plus, it covers digital pharmacovigilance, which completely modernizes how we report adverse drug reactions to make sure patients stay safe long-term. All right, let's push into section 3, AI and emerging tech. We are officially exploring the frontier of care. Pushing the boundaries even further brings us face-to-face with an incredible arsenal of emerging tech. I mean, we're talking about generative AI tools like ChatGPT and Gemini that are right now, as we speak, directly improving clinical documentation and decision support. We're also exploring the Internet of Medical Things, wearable health tech, and how blockchain can securely lock down patient data to prep you for the precision medicine of tomorrow. It's wild stuff. But hold on. Section 4 is guardrails, safety and ethics, because we definitely need to know how to navigate the dangers of this new digital frontier. As the saying goes, with great technological power comes some massive ethical responsibility. You are going to learn how to ethically manage patient consent, confidentiality, and professional accountability, all within very specific legal frameworks. Module 4 makes sure you aren't just innovating, but that you're innovating legally. You'll unpack the strict guidelines of the Pharmacy and Poisons Board, fully grasp digital consent, and navigate the super complex ethics of cross-border digital health. On top of that, you'll be armed with the exact risk management strategies you need to protect your digital systems from some very real cyber threats, like ransomware.
Module 5 is basically a crash course in defending patient data. You'll learn the ins and outs of role-based access control, the absolute necessity of cloud encryption, and exactly how to formulate a rock-solid disaster recovery plan. Because let's face it, in healthcare cybersecurity, it's a matter of when an incident occurs, not if.
Which leads us to our final leg, Section 5, Becoming a Digital Leader, going from practitioner to innovator. Finally, we reach the ultimate goal of the whole journey, evolving into a true healthcare visionary. Modules 8 and 9 give you the serious business acumen you need, everything from SEO marketing to change management, making sure you actually know how to scale a sustainable digital health venture. This is where you learn to build a legit business plan around a digital pharmacy model. You'll study how to leverage search engine optimization to reach more patients, how to build strategic partnerships, and crucially, how to champion digital readiness within a larger healthcare organization. The whole shebang culminates in Module 10 with a step-by-step capstone project. Here, you'll identify a real-world problem, design a custom digital solution, and then actually pitch it to experts. This isn't just some final exam you take on paper. No way. It's a highly practical, implementation-ready business pitch. You've got to use design thinking to synthesize literally everything we've talked about, from interoperability to AI to cybersecurity, into a sustainable, functional healthcare solution. So what does this all mean for you? Well, the digital health revolution definitely isn't waiting around for anyone. So how will you apply these tools to shape the future of your practice? The AGLS 5-week course gives you the blueprint, it gives you the tools, and it gives you the guardrails. The only question left is, what innovative solution are you going to build with them?